So hi guys, my name is FAZWINA. So I'm gonna talk about our lymphatic system of our body. Lymphatic system is a network of conduits that carry a clear fluid. Clear fluid as lymph. So let's start with the anatomy of lymphatic system. Lymphatic vessel is a tube that assists the cardiovascular system to remove of tissue fluid. So where is the location of this lymphatic vessel? Lymphatic vessel will go through all over our body except central nervous system, eyeball, internal ear, epidermis of the skin, cartilage bone. So lymphatic vessel has two types, which is superficial lymphatic vessel and deep lymphatic vessel. Tissue fluid that entering the lymphatic vessel, we call it as lymph. The lymphs will pass over one or more lymph before entering the bloodstream. In the lymphatic vessel, there is efferent vessel and efferent vessel. There is presence of the valve. So the function of the valve is to prevent the backflow of the lymph. It's lymphatic capillaries. The structure of lymphatic capillaries, it is blind end and a single layer of overlapping endothelial cell. It is more permeable than that of blood capillaries. It is absent from avascular structure, brain, spinal cord. Small intestine contains special types of lymphatic capillaries that called lacteals. Lacteals pick up not only intestinal fluid but also it absorbs dietary lipids and lipid-soluble vitamins. The lymph of this area has a milky color due to the lipid. It is also called as chyle. So we go to the next, which is lymphoid, or another name for lymphatic tissue. So what is lymphoid? It is a type of connective tissue that contains of lymphocyte. Lymphocyte is a type of white blood cell and part of our immune system. So lymphoid has in thymus, spleen, and lymph nodes. Lymph trunk, collection of lymph vessels that carries lymph. It is formed by confluence of many efferent lymph vessels. There are 5 types of lymphatic. So for the lymphatic trunk, there is 5 of the main lymphatic trunk, which is the first one is right jugular trunk and left jugular trunk. And then we go through to the next one is right subclavian trunk and left subclavian trunk. And then we move to the right bronchomediastinal trunk, which is in this, and left bronchomediastinal trunk in. So for the fourth one is right and left lumbar trunk, which is this one. Lumbar trunk, which is in this, and is intestinal trunk. This one. Lymph node. It is small, round, and oval. It is located along the pathway of lymph vessel. It is to receive lymph from any region. Lymph nodes are also found individually throughout the body tissue. The features that lymph nodes have is bean-shaped body with efferent lymph vessel and efferent lymph vessel. It is also arranged in groups along the blood vessel or the flexural side of the. So for the structure of the lymph node, this is the fibrous capsule, which is the outer layer of the lymph node, and then we go to the trabecula, which is the inside of the lymph node. And then this is the efferent lymphatic vessel, which is where the lymph fluid come in. And then this is the efferent lymphatic vessel, which is the lymph come out. Yes. So there are 7 types of lymph nodes that are inside of our body. So the first one is thoracic cavity nodes, which is in this, and then cervical nodes, which is in here, and then axillary nodes. It is at the armpit, and then supratrochlear node in this, and then abdominal cavity nodes in here, and then pelvic cavity nodes here, and the last one is inguinal nodes here.
Hi, I am Putri BALKHIS binti PUTRA. I will explain about the anatomy of the cortex, the medulla, the lymphatic system, and the spleen. Let us proceed to the cortical structure of lymph node. Many reticular cell, macrophage, antigen-presenting cell, and lymphocyte are found in the cortex. Cortex also contain lymphoid nodules secreted primarily by B lymphocyte, a subscapular sinus, and a cortical sinus that runs between nodules. The medulla has a lighter or brighter appearance compared to the inner cortex because it's not a densely packed with cell. That because the medulla had many open space or area that form the medullary sinus, which is where the lymph from the cortex collect before exciting the lymph node through the efferent lymphatic vessel. The shape of the sinus is formed by the surrounding medullary cord, which is a regular cord that contains macrophage, B cell, and plasma cell. Medullary cord is a branch cord-like extension of lymphoid tissue arising from paracortex. In this diagram, we can also see a few blood vessels within the metal area cord as well. The medulla has a lighter or brighter appearance. The lymphatic system is a drainage system that removes excess fluid from body tissue and return it to the bloodstream. It is actually a subsystem of both the circulatory and immune system. The major purpose of the circulatory system is to bring oxygen and nutrients to body tissue and remove waste. This exchange happens in the smallest blood vessel called the capillaries. Blood plasma containing nutrients move out of the capillary at the atrial end of capillary bed, while tissue fluid containing waste reabsorbed back in at the venous end. However, not all of the fluid is drawn back to the bloodstream at this point. About 15% of it is left in the tissue and would cause swelling if accumulated. This is where the lymphatic system comes into play. It speeds up the excess fluid and returns it to the circulatory system. Unlike the blood circulatory system, which is a closed loop, the lymphatic system is a one-direction, open-ended network of vessels. The lymphatic system. The spleen is the largest lymphatic organ in the body and formed by reticular and lymphatic tissue. With a dark reddish-purple color, it sits right behind the stomach and has a weight about 200 grams. Spleen is slightly oval, which enclosed in a fibroelastic capsule. Spleen has two main components, which is white pulp and red pulp. The red pulp makes up about 75% of the spleen volume and is comprised of the cord of Billroth and venous sinus. The cord of Billroth or the sphenic cord are lined with connective tissue and fibroblasts. They are also full of macrophage. Interspersed within red pulp are pockets of white pulp, which are similar structure to the lymph node, with T cell zone and B cell follicle. In the spleen, the T cell zone surround the arteriole and located in the lymphoid sheath or PALS. Outside the sheath are the B cell follicle, which are surrounded by the marginal zone, which is where the white pulp meets the red pulp.
Hi, I'm IZZATI. Will explain about splenic pulp, splenectomy, thymus gland, and discharge syndrome. The spleen has two tissue types, the white pulp and the red pulp. The white pulp is the lymphoid tissue of the spleen and contains lymphoid elements including follicles, lymphocytes, and plasma cells. Lymphocytes are produced in terminal centers, which are at the center of follicles. There are also phagocytic cells known as macrophages, which reside in both the white and the red pulp. The red pulp constitutes most of the spleen's volume. It consists of venous sinuses and cords of lymphatic cells, including lymphocytes and macrophages. As blood flows through the spleen, macrophages and dendritic cells within the red pulp and marginal zone capture and present antigens to T and B cells, initiating immune response. Splenectomy. Your doctor has recommended that you undergo a splenectomy or spleen removal surgery. But what does it actually mean? The spleen is one of the organs in your body that works to clean your blood. The spleen is located behind the stomach and to the left of the liver. Specifically, the spleen picks out and destroys red blood cells that are no longer useful. A splenectomy is a surgical procedure used to permanently remove the spleen from the body. Reasons for the removing of spleen vary. The spleen removal surgery is performed in an emergency situations during which internal bleeding may be putting patients' life at risk. This program assumes, however, that you are not currently in an emergency setting. In your case, the reason for removing the spleen may be to treat a blood disease, blood congestion, Gaucher's disease, white blood cell deficiency, the growth of a tumor, or the growth of the cyst. Thymus. The thymus is a bilobe lymphoid organ situated in the superior mediastinum and often extends above in the root of neck and below in the upper part of anterior mediastinum. It is usually prominent in the children and gradually increases in size till puberty. It weighs about 40 grams. Thereafter, it atrophies and gets infiltrated by fibrous and fatty tissue. It is related anteriorly to sternocleidomastoid and sternothyroid muscles and sternum, and posteriorly to the pericardium, arch of aorta, and its branches, left branchiocephalic vein, and trachea. It secretes a hormone called thymosin, which plays an important role in the development of immunity of the body. Thymus. The thymus is a bilobe. Next, I will explain about structure of thymus gland. The thymus gland is comprised of two lobes joined by areolar tissue, and it is enclosed by a fibrous capsule. Within the gland, the tissue is divided into incomplete lobules, each containing the cortex and medulla regions. The cortex houses immature T lymphocytes, while the medulla contains mature T cells and hassas corpuscles. The fibrous capsule provides structural support to the thymus, maintaining its overall integrity. Cortex. The cortex of the thymus gland is the outer portion, rich in small and dense lymphocytes. This region contains a large number of small, densely packed precursors of T lymphocytes undergoing maturation. The process in the cortex is vital for the development of functional T cells, contributing to the immune system's ability to recognize and respond to pathogens. Medulla. The medulla of the thymus gland contains specialized epithelial cells concentrically arranged in structures known as medullary of hassas corpuscles. Thymic hassas corpuscles consist epithelial reticular cells filled with keratin and sometimes calcifies. Additionally, the medulla contains macrophages and dendritic cells that contribute to immune response regulation within the thymus. What is discharge syndrome? Discharge syndrome is a congenital disorder characterized by the failure of the thymus to develop properly. This results in the inability to produce T cells, essential for a functional cellular mediated immune response. As a consequence, individuals with discharge syndrome are highly susceptible to infections. Due to the compromised immune system, patients may face health challenges and may unfortunately die at an early age. The syndrome is often associated with a range of other symptoms affecting different organs and systems.
Hello everyone, my name is NURSHAZMIN. Now I am going to talk about a path of lymph flow through lymph node. Okay, the path begins when afferent lymphatics penetrate the capsule of the lymph node on the side opposite the hilum. The afferent vessels deliver lymph to the subcapsular space, a meshwork of reticular fibers, macrophage, and dendritic cells. Dendritic cells are involved in the initiation of the immune response. Lymph next flow into the outer cortex, which contain B cells within germinal centers that resemble those of lymphoid nodules. Lymph then flow through lymph sinus in the deep cortex, which is dominated by T cells. Lymph continues into the medullary sinus at the core of the lymph node. These regions contain B cells and plasma cells. Efferent lymphatics leave the lymph node at the hilum. These vessels collect lymph from the medullary sinus and carry it toward the venous circulation. Next, I would like to share about the formation of lymph. It starts when the lymphatic vessels reabsorb interstitial fluid from the periphery to return it to the intravascular space, which prevents fluid buildup in peripheral tissues. Because of blood in arteries are under high pressure, they force out some fluid through the capillaries. This fluid is called tissue fluid and surrounds all the cells of the body. Excess filtered fluid are about 3 liters per day and drain into lymphatic vessels and become lymph. The important function of lymphatic vessels is to return lost plasma protein to bloodstream, which contain valve to prevent the backflow. Approximately 85% of fluid that leak out of blood returns to blood via blood capillaries. 15% returns via lymph capillaries in 24 hours. Lymphatics return fluid equivalent to entire blood volume. The lymphatics allow for the immune system to function properly as it carries antigens to lymph node and also carries immune cells such as macrophage to sites of infection to begin the immune process. Okay, the lymphatic system helps maintain fluid balance in the body by collecting excess fluid and particulate matter from tissues and depositing them in the bloodstream. It also helps defend the body against infection by supplying disease and fighting cells called lymphocytes.
Assalamualaikum. I am Ekmal and I'm going to explain about the immune response in lymphatic system. Okay, firstly, we record a bit about the immune system. Firstly, we have to understand the circulatory system. The circulatory system shows that the heart pumps blood through the aorta and then through the artery to the arteriole into the capillary. From the capillary back to the goes to the venule to the vein and back to the heart. So why the blood has to go through capillary in order to provide the cells with oxygen and nutrient. So the cells we use the oxygen and nutrient for metabolic process and produce carbon dioxide and waste product, and it will go back into the heart through the veins. So from 100% of the blood that go through the capillaries, only 90% of the content will go back to the heart through the vein. So the other is going to go back into the vein, but not directly. It is through the lymphatic system. So the interstitial fluid that leak up from the capillaries will be absorbed into the lymph vessel from the lymph capillaries. So, as they absorb into the lymph capillary, they will become lymph. So the fluid called lymph will move through the lymphatic vessel and move to the nearest, firstly to the nearest lymph node. So they will enter the efferent lymph vessel and be inside the lymph node. So in the lymph node, they will be processed, the pathogen will be killed, or some of them will be tagged so that it can trigger general immune response. And next, they will go out of the lymph node through the efferent lymph vessel, go through the lymph trunk, and then to the lymphatic vessel, lymphatic duct, and lastly back into the venous so that it can pump back into the heart. So the reason why the lymph have to be reabsorbed through the lymphatic capillary so that it can, so that the lymph node and other lymphoid organ can it is important for the immune system so that it can filter all the pathogens. Okay, so what are exactly in the lymph? They are fluid from the lost from the capillary, and then this is what we're going to focus, the pathogens. There are also cell of lymphatic system, cell product, for example hormones, cell debris, chylomicron from the gut. Chylomicron are the fat that has been packaged into the form of chylomicron, and also for pathological, they are metastasis or the carcinoma. And then, like I said earlier, the fluid have to go through the lymphatic system so that it can be filtered by the lymph node. They filter those pathogen or any foreign object to avoid infection. So, what are the component that help to filter the lymph fluid in the lymph node? They are the lymphocytes and also some other macrophages. So the lymphocyte are like the police. So we can imagine the lymph node like the interrogation room. So the police, which are the lymphocyte inside, they are lymphocyte. They are B lymphocyte and also T lymphocyte, which can trigger more specific immune response so that it can handle infection more effectively. So they destroy the pathogen and the bacteria cannot enter the blood circulation. Okay, this is our lymph node. So as we can see, there are efferent vessel and efferent vessel. So as we learn that lymph node are kidney shaped small encapsulated bodies located along the course of lymph vessel. So like I said earlier, there are lymphocyte and macrophages. Lymphocyte, the B lymphocyte and T lymphocyte. B lymphocyte mostly are in the cortex, while the T lymphocyte are mostly in the paracortex around here. So the lymph node consists of cortex and medulla. Cortex which contain lymph follicle and also receive lymph from the efferent vessel, while the medulla, there are no follicle and medulla, and they have the sinuses around here that lead to the hilum. This is the part of we call hilum. So to conclude, lymphatic system is very important in immune response or our immune system to protect our body from pathogens such as bacteria and viruses. So that's why some of the blood content have to seep into the lymphatic capillary and into the lymphatic vessel so that our lymph nodes can filter out all of the dangerous bacteria and the viruses in order to protect our body from infection.
Is lymph nodes. So the structure of lymph node is small, bean-shaped structure along lymphatic vessels, and it has three functions, which are, the first one is it will filter the lymph, and the second one is remove the pathogen, and the third one is activates immune response. So as lymph nodes enter one end of a lymph node, foreign substance trapped by the reticular fibers within sinus of the nodes. The macrophage destroy some foreign substance by phagocytosis, while lymphocyte destroy other by immune response. Since there are many afferent lymphatic vessels bring lymph into lymph nodes, and only one or two afferent vessels transport lymph out of lymph. So the lymphatic vessels. The structure of lymphatic vessel is drain was tube parallel to blood vessels. It has two functions, which are drain the excess interstitial fluids and transport dietary lipids. So for the first function, which is the drain excess interstitial fluid, the lymphatic vessels drain excess interstitial fluid from tissue spaces and return it to blood. This function closely links it with cardiovascular system. Without this function, the maintenance of circulating blood volume would not be possible. So the second one is the lymphatic vessels. The lymphatic vessels transport lipid and lipid-soluble vitamin, which are vitamin A, vitamin D, vitamin E, and vitamin K, absorbed by the gastrointestinal tract. Spleen is the large organ filtering blood, removing ulcers and storing platelets. It also functions as antigen-presenting cells, which are dendritic and macrophages. It also activation and proliferation of B and T lymphocytes. Not only that, it also produces the antibody. The function of spleen also remove the macromolecule antigen from blood. It also removable and destruction of red blood cells and platelet. It also produces the formation of red blood cells in fetal life. It also storage of blood, which is red blood cells, but only in certain species. For spleen, it composed of reticular cells, lymphocytes, blood cells, macrophages, and ACPs. It divides into two, which is white pulp and red pulp. So for white pulp, it contains mass of lymphocytes formed pus around branches of splenic artery. The lymphoid nodules with germinal center. For red pulp, it contains large number of red blood cells that has been filtered and degrades. And it divides into two parts, which are splenic cords and splenic sinuses. So the fourth one is the thymus. Thymus is the gland crucial for the maturation of T cells or T lymphocytes. So the cortex composed of large number of T cells and scattered dendritic cells, epithelial cells, and macrophages. Immature T cells migrate from red bone marrow to cortex of the thymus, where they proliferate and begin to mature. Dendritic cells in other parts of body, such as lymph nodes, play another key role in immune response. Each of specialized epithelial cells serve as framework for as many as 50 T cells. They produce thymic hormones to aid in maturation of T cells. Only about 2% of developing T cells survive in cortex. The remaining cells will die via apoptosis. So the thymic macrophage help clear out debris and of dead and dying cells. The surviving T cells enter the medulla. Tonsil is the cluster of lymphoid tissue in the throat, trapping pathogen. So as we can see in this slide, when the tonsil is inflamed, so it will show that our tonsil is red.